Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Can photoacoustic ultrasound catch breast cancer earlier? Break key takeaways. Mammograms can miss up to half of breast cancers in women with dense breast tissue, and insurance typically won't cover breast cancer screening for women under 40. A new startup called BeSound plans to offer photoacoustic ultrasound as a radiation-free alternative for earlier detection. However, there's no clinical evidence on whether photoacoustic ultrasound is more accurate than mammography. Break breast cancer death rates have dropped by more than half over the past 50 years, in part thanks to better screening methods that help clinicians detect and treat the disease earlier. Break for women with dense breast tissue. There's still room for improvement. Mammograms don't always detect abnormalities in women with dense breasts. Meanwhile, women younger than 40 who are more likely to have dense breasts aren't eligible for cancer screening under the current guidelines. Break. A new startup called BeSound is trying to expand access to more comfortable breast screening options, including an imaging approach called photoacoustic ultrasound. The company says ultrasound can detect cancer earlier than traditional screenings, even in people with dense breasts. Break. Where mammograms fall short in detecting breast cancer. Break. Mammography, an X-ray test, is the current gold standard for breast cancer screening. It helps radiologists identify areas of dense tissue that could signal a tumor. Break. However, mammograms don't always catch lumps in dense breast tissue. About 10% of women have extremely dense breasts, which puts them at a much greater risk for cancer, while 40% of women have a mix of fatty and dense breast tissue. Mammograms miss about 25% to 50% of breast cancers in those patients, depending on the density of their breasts. Break. Using mammography to find abnormalities in dense breast tissue is like driving a boat into a fog bank, said Robert Smith, Ph.D., Senior Vice President of Early Detection Science at the American Cancer Society. Break. And number 156, do you just drive right into it, imagining that there's probably nothing there? Smith told Verywell. That's kind of what was happening to women for years, when their doctors would say their mammogram was normal, but half of the breast was obscured by dense breast T less than /speak issue. You couldn't tell whether there was a cancer there or not. Break. What is photoacoustic ultrasound and is it better than mammography? Break. Ultrasound imaging is FDA-approved for breast screening and several other procedures. It uses non-ionizing radiation, so it doesn't have the same health risks associated with the radiation in X-rays and mammograms. A review of studies finds that ultrasound may detect up to 7.7 more cases of breast cancer per 1,000 women than mammography. Break. And number 156, although we know that ultrasound can find so many more cancers in women with dense breasts, a lot of women don't get the opportunity to have that ultrasound because their practices don't offer it. And number 157, said Rachel Brem, MD, an advisor to BeSound and vice chair of radiology at George Washington University School of Medicine. Break. However, ultrasound imaging tends to detect many more false positives than other major screening types. To check whether a lump is benign or cancerous, BeSound follows up with a technology called photoacoustic imaging. This measures oxygen and blood flow to the tissue using light and sound. Break. The FDA cleared photoacoustic imaging in 2021, meaning the agency considers it to be safe and effective for its intended use. Break. However, Brem said BeSound has not clinically tested whether the combination of ultrasound and photoacoustic imaging performs as well or better than MRI or enhanced contrast mammography. Break. Smith said comparing the test's effectiveness against mammography is crucial. Break. And number 156, for as long as we've been screening women for breast cancer, there have been tests marketed. And number 148, electrical impedance and heat scanning. And number 148, all sorts of things that are promoted as comfortable, with no radiation and no compression. But they can't say they're just as good when compared to traditional imaging tests. They're just comparing features of the examination, not its accuracy, and number 157, he added. No major medical organization recommends standalone ultrasound imaging for breast cancer screening in women of any risk level. For some people with dense breasts, the Centers for Disease Control and Prevention, CDC, recommend talking with your doctor about your risk factors for getting breast cancer and other tests, such as an MRI. Related stories: what you should know about your mammogram. See a dermatologist before something concerns you. Who should get photoacoustic ultrasound? BeSound hopes to app less than /speak appeal to women younger than 40 years old, who are more likely to have dense breast tissue than older women. About 85% of breast cancers occur in women with no family history of the disease. However, health insurance typically only covers screening mammograms for women aged 40 to 74 based on recommendations from the U.S. Preventive Services Task Force. Women younger than 40 may have the test covered if they have a family history of breast cancer or are experiencing symptoms, but they should be prepared to pay out of pocket. BeSound imaging is available to any asymptomatic woman ages 25 and older. The company is opening its first clinic in California this fall, and several others around the country will follow soon. Number 156, there's really no downside and a huge upside opportunity to find early, curable breast cancer in younger and younger women, and number 157, Brem said. How much does it cost? The cost for a BeSound screening starts at $350. Brem said the company aims to offer a and number 156, spa-like environment, and number 148, a very welcoming and warm environment, and plans to return results to patients within a couple days to reduce any feelings of anxiety while they wait. Smith said that if women younger than 40 want to get a test for their peace of mind, they can request a mammogram from their physician. And number 156, by all means, for your own peace of mind, he added. But you should get a test that's accurate enough that you can have confidence in the findings of your examination, and with all the advantages that are being described for this test, accuracy is not among them. RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.